name's Rachel, and I'm going to be your student nurse today. And I'm just going to do a quick head-to-toe assessment, but first I'm going to close that for some privacy. And can I see your wristband and name and date of birth?
Angela Lemansky, 6/26/96.
Okay, good. And do you know what year we're in?
2016.
Good. So my patient is alert and oriented ×3. And she appears to be well-groomed. She has good hygiene. No odor is coming from her. She is speaking clearly, and she doesn't seem to be any distress or anything, and her mood is appropriate for the situation. And then, Angela, how are you feeling today? Do you have any pain?
No pain.
Good. What about any allergies I should know about? To any meds or anything?
No.
Okay, perfect. So with that, then, we are going to get started. Okay, so first I'm just going to palpate your scalp. And is there any tenderness or anything?
No.
Okay, so her head has equal distribution of hair, and it's symmetrical. I don't see any bumps or any lesions or any bruises or anything. The color and temperature is also good. And same with on her face, so that's good. And then I'm just going to do a quick cranial nerve test, and I'm going to touch certain places on your forehead, or I'm sorry, on your face, and if you could just tell me where it's at. But first you have to close your eyes, okay?
Forehead.
Good.
Chin.
Okay, good. Cheek. Good. So cranial nerve 5 is intact. And now I'm just going to take a look at your eyes, and can you just look at me? So both of her pupils are round and equal. So now I'm going to shine my light into your eye. Good. Okay, so both pupils constricted when the light was shown into them, which they should. And now I'm just going to pull down both of these. Okay, so her conjunctiva is pink and her scleras are white, which that shows like no signs of jaundice or anything out of the ordinary. I don't see any discharge or any drooping, so again, everything appears to be normal. So now I'm going to bring this towards you, and if you could just follow it with your eyes. Okay, good. So her eyes can accommodate. And now, also, Angela, can you just follow my pen light with your eyes? Keep your head straight. Okay, so she was able to follow all fields of vision with her eyes. So everything seems to be working just fine in her eyes. And now I'm going to take a look at your mouth, and as just looking at it right now, I can tell that her lips are moist and pink and symmetrical. So now can you open up? Okay, so inside, I don't see any edema or bleeding from her gums. Her mucosas all look pink and moist, and her teeth, she doesn't have any dental work, and they appear to be intact and not broken and white. And so now I'm going to have you open up one more time and say ah. Good. So her uvula went up, and it is midline. And then also her tonsils were at a 1, which means that there doesn't appear to be any infection or irritation. Okay. So now I am going to move on to your neck. And I'm just going to take a look, and her trachea appears to be midline. Nothing seems out of the ordinary. And now it's okay. I'm also going to check your carotid pulses. Okay, and so both were equally strong, and I would grade them at a 2. And now I'm just going to take a listen to hear if I hear any bruise. And then can you hold your breath for me on both of them? Good. Okay. So, I didn't hear anything out of the ordinary, so no bruise could be found that I heard. And now, I'm going to move on to your arms. So now looking at her arms, I'm just feeling them and looking for any abnormalities. I don't see any lesions or anything like that. The skin on both of them feels warm and dry, which is perfect. And now I'm going to test cap refill on there, and that came back just fine in less than 3 seconds, so her circulation is good. And now I'm going to check your brachial pulses on both of them. Okay, so again, both of them were equal and had a grade 2 pulse, and now her radial pulses. Okay, those were both grade 2 and equal. And now, can you do me a favor and can you squeeze my fingers? Okay, so both had equal strength, and now I'm going to push down. Okay, and now can you push up? Or I push up? Good. Okay, so both of her hand strengths were equal, so no like one-sided weakness or anything like that. So now I'm going to take a listen to your lungs and your heart, all that fun stuff. Yeah, perfect. So now, Angela, can you just do me a favor and take big deep breaths for me? Good. And one more big deep breath. Good. Now, can you put your arms out in front of me like a genie, like this? Perfect. And now I'm just going to check the sides. Take deep breath. Good. And good. So all posterior lung sounds sounded clear, and there weren't any crackles or any signs of like pneumonia or anything like that. So now I'm going to, first, I'm sorry, can you spin back around? Okay, can you lean forward for me? Okay, and so her spine doesn't have any abnormal curvature or anything, so no signs of scoliosis or anything like that. And then I'm also going to just pound on your back for a second and tell me if there's any tenderness.
Nope.
Nope. Good. Okay. And now I'm going to listen to the front part of your lungs. So again, just big, nice, deep breaths for me. Okay? Okay, so again, your your lungs sounded clear. There were no crackles or any wheezing, nothing like that. So now I'm going to take a listen to your heart, and then just breathe normally for me. And so this is her aortic point. Pulmonic. Erb's point. Tricuspid. And then this is her mitral. Okay, and at the mitral place, I would listen for a minute for the apical heart rate. And now I'm going to listen with the bell of my stethoscope, which will let me hear any dull sounds. And again, this is mitral. This is tricuspid. This is Erb's. Pulmonic. And aortic. Okay, so everything appears to be good. I didn't hear any extra heart sounds, no murmurs or anything like that. It was a strong and steady beat, so no irregular heartbeats or anything like that. So now I'm going to have you lay down here, and we're going to, and then we're going to take a look at your abdomen. Perfect. Okay, so first I'm going to inspect it, and I'm going to look for temperature. Okay, so it felt normal and the right temperature. The coloring is good. The contour is flat. I don't see any distension of anything. And so I don't see any scars or any marks or anything bad like that. And then I do see her umbilicus is midline. And now I am going to listen. So we're going to start in the lower right quadrant. Okay, and I do hear vowel sounds, which are normal. And in the lower right quadrant is your appendix and your right ovary. And now up top at the upper right, again I hear clicks and gurgles, so vowel sounds are present and normal. And your liver and your gallbladder are up in that quadrant. And then in the upper left, again, I hear clicks and gurgles and normal vowel sounds, and that is your liver your stomach and your your left kidney. And then in the lower left, I hear normal vowel sounds, and that is your left ovary and your sigmoid colon. So now what I'm going to do is I'm just going to palpate, and you're going to tell me if you feel any tenderness, okay? Any tenderness? No? Okay, so I don't feel any distension, and she reports no tenderness or pain. So everything seems good for that. And now I'm going to listen for tympanic or dullness. And up in the upper right quadrant by her liver sounded dull, but everywhere else sounded tympanic, so that's all set. And then you can sit up for me. And now as you do that, I'm checking for JVD, which I don't see because there were no external signs of veins popping out of her neck. So now I'm going to look at her lower extremities. And as I do that, the first thing I know is no edema, which is always good because that could be signs of poor circulation. And the color is normal for her ethnicity, and the temperature was also warm for both legs. And I don't see any lesions or any marks. I do see a couple of bruises, but they are okay. They seem to be healing normally. And now, so I'm going to check for your palpatile pulses. So if you could do that, yeah. Okay, so both are equal and bilateral, and they have a grade of 2. And then down here, I'm going to check for your dorsal pedialis pulses. And again, those were +2s and equal on both sides. And then inside is your anterior tibialis pulses. And again, they are equal and bilateral and have a strong pulse but not bounding, so that would be a grade 2. And now I'm going to check for cap refill. And they came back in less than 3 seconds, so that helps to prove that she has good circulation in her feet. So now I'm going to have you stand up. Actually, can you sit down real quick? I forgot. Can you sit back and can you crunch up your toes for me? And I'm going to do the Babinski test. And both of her toes flexed outwards when I tickled the bottom of her feet. So it shows normal reflexes. Now can you stand up for me, please? And my patient appears to stand up just fine by herself. But please close your eyes, and this is the Romberg's test. And she's just going to stand here for about 20 seconds. And she doesn't seem to be swaying or have any unsteadiness, so that's perfect. You can open up your eyes, and now can you please turn towards me, and can you please walk a couple of steps? Good, and then can you turn around and walk some more? Okay, so my patient's gait was steady and strong, so she didn't need any assistance or anything like that. She wasn't lightheaded or anything. So overall, I would say that my patient is healthy and doesn't show any signs of abnormalities.